Hi everybody, my name is Dr. Hilary Booth and I'm a naturopathic doctor, and welcome to my video blog. Today, before I get started, I just want to remind everybody that it is now November, which other than mustaches and the cold weather, means that you only have 2 more months before your extended healthcare insurance expires for the year. So most of us have something in our lives, whether it be chronic pain or sleep issues or maybe some weight loss goals that we want to tackle. And if you do have some extended healthcare coverage to use up, this is now the time to book your appointment with me to use up that healthcare coverage by the end of the year to get started on working on some of these things that have been bugging you about your health. So today, this week in our video blog, I'm going to be talking about acne. It's something that many people struggle with breakouts, especially in their adult lives. And as with anything, we need to make sure that we're treating the underlying cause of the issue, not just working on sort of just topical type things, but there's always a reason from the inside of the body why we're experiencing acne breakouts. So today I'm going to touch on my top 5 reasons for acne and what we can do to fix those things. So my reason number 1 is hormone imbalance. Now, if you have acne, especially around the mouth and the jaw and sort of on the jawline, this is a really, really big indicator for me as a naturopathic doctor that your hormones are out of balance. Now, types of breakouts often, these will cycle with your menstrual cycle and get worse just before your period starts, and typically get better once the flow starts of your period. But you might have other symptoms. You might have symptoms of thinning hair on the top of your head, of easy gaining weight and difficulty losing that weight. You might have irregular periods as well, and you might have some more hair growth on your jaw or on your forearms. These are all symptoms of a condition called PCOS. And now PCOS, basically, there's a hormonal imbalance where you have extra testosterone in your body that causes you to get these acne breakouts. And these breakouts can be quite painful, and they can be underneath the skin, sort of that trapped, painful, cystic feeling. And those are really, you need to be treating the underlying cause of those because they're not going to go away with just topical solutions. Now, you can also have these type of cystic, painful, underneath the skin sort of jaw type of breakouts if you have another hormone imbalance of excess estrogen in your body. And again, you're going to experience a worsening of the acne before your period, and it gets better after your period starts. Now, these can be treated with herbs really, really effectively, and we can do some hormone testing to see whether or not your hormones are out of balance, and then we can put them back into place. So our second reason that I see for acne would be high stress. Now, stress is something that I see stress breakouts typically on the chin. You'll get like 1 or 2 pimples if something stresses you out, but they can also be on the forehead or anywhere on the face, and they can be on the chest and the back as well. It can run in a very different pattern for different people. But typically, the breakouts surge when you have a surge of your stress hormone cortisol. Now, stress is obviously something very, very difficult to treat for a lot of people, but there are some quick little tips I can give you. The first is to learn how to say no. It's really difficult for a lot of us, but it's something that we need to learn how to do, especially when we're up to here with stress. Another is to learn how to ask for help. Find someone in your life that you can sort of team up with and work to reduce your stress levels when you need that extra help. Now, you can also try and take just even 5 minutes of every day and spend it on yourself. Maybe that's just taking a couple minutes and doing some deep breathing or some journaling or some stretching, something like that, just to really debrief about your day and ask yourself, what do I need right now and how can I go about giving that to myself? And this can make lots of changes and improvements for your stress levels, but sometimes you do need a little something extra. Sometimes that's not enough in order to bring your stress down and allow you to cope better with the things that are going on in your life. And of course, prevent those acne breakouts from happening. So in order to do that, we can bring down your stress levels with supplements and with some herbs. And these things are really, really effective at bringing down those stress levels and that cortisol levels at the end of your day, and then raising your melatonin levels at night. And I encourage you to come and book an appointment with me if that's something you want to look into, because it can be quite dangerous and unsuccessful if you try and do supplementation on your own, because it can actually make the situation worse. So my third reason that people are experiencing acne breakouts is they have a sluggish liver. Now, what does that even mean? So the liver is our primary detox organ for your hormones that your body is done with and for your toxins. We're being bombarded all the time with toxins in the air, toxins in our water, in our food, but also just sort of the typical things, even if we're eating a very clean life, you're going to be experiencing toxins coming at you regardless of sort of your best efforts. Now your liver is what kind of combats all that. It translates it from its toxic form into the form where we can excrete it from the body. Now, if our liver starts getting blocked up at any point on this detox pathway, it's like a conveyor belt. If you block it up at any point in time, you're going to start to get symptoms where your body is trying to find other ways that it can get rid of these toxins, and the other major way is through your skin. So it's going to come out in your skin as soon as that conveyor belt is blocked. So different things that we can do, we can eat lots of vegetables from the brassica family, which includes cabbage and Brussels sprouts and broccoli. It also includes mustard greens and collard greens, and you can eat these as much as possible, as well as nuts and seeds are great sources of minerals for your liver. You can drink lemon water, that'll help promote the liver along, and you can also do castor oil packs over the liver. Now often, nutrition and eating right can sometimes not be enough to get that liver going, especially once it's really, really slowed down. Picture that conveyor belt's been stopped and things are falling off and there's things going wrong all over the place. You're going to need to do a lot more to get it back on track. So there are some supplements that I really like to use. NAC, curcumin are all really great. Milk thistle and dandelion, and B vitamins can be amazing to help get that liver back on track. But again, I'd urge you to seek naturopathic care in order to make sure that you're doing this doing your body justice and that you're taking the right things for you, because that might be different than what someone else might need. Now, also for the liver, it's really important to realize that you do have to change the toxins that you're putting into your body and on your body. So that means maybe slowly changing out your soaps and your creams and your shampoos into more natural and body-friendly types of things. So my fourth reason that people are experiencing acne is they have a food intolerance. Now the most common culprit here is going to be dairy, and that often causes that red acne on the forehead that can be bumpy and it can be itchy. And so all these things, this itchy, bumpy forehead, can be a sign that you may have a dairy intolerance, but another food intolerance can be the cause as well. So there are two things that you could do if you suspect this might be you. You can either do food intolerance testing with me at the office, and that's really simple. We just do a little finger prick test and it tells you 96 different foods that you may be intolerant to. Or you can also just do trial and error. So you can try taking out all dairy products for at least 2 weeks and see how it goes. Maybe that red, bumpy, itchy, sort of irritated skin will go down. Maybe it won't. Maybe you need to then reintroduce the dairy and try something different. You might want to try gluten or egg, or soy can also be another major factor for causing acne in people as a result of a food intolerance. Now this is because food intolerance causes inflammation in the body, and inflammation can often come out in the skin as something like acne. Now, my fifth and final reason that people experience acne is constipation. So we want to be having at least 1, if not 2 or 3 bowel movements every day. And the reason for this is that remember we talked about that liver conveyor belt processing our toxins and our hormones. Once those are processed, the liver actually squirts your bile into your digestive tract, and that's moved out and it should be excreted through a bowel movement. If you're not having regular bowel movements, those toxins and hormones sit in your digestive tract, in your intestinal tract, and they'll get reabsorbed into the bloodstream. So that means they're not getting excreted and they're getting brought back into the bloodstream. So you're going to build up more and more and more over time if you're constipated. Now, this buildup over time, again, just like the liver, it needs another place to go. So it's going to go to the skin and you're going to get those acne breakouts. So the best way to try and get that those bowels moving is by increasing the amount of fiber you have in your day to at least 40 grams per day. The way to do this is just 2 tablespoons of flax seeds, chia seeds, or hemp seeds are great, or hemp hearts are great, sprinkled onto your breakfast, sprinkle on your salad, put on your veggies, whatever you want. Also, you can have more nuts and seeds. You can have beans. Those are a great source of fiber. And dark leafy vegetables are also wonderful. Now, another way to get those bowels moving is to make sure that you are having lots of water in your day. So drink more water. You need to have at least 2 liters, and for some people that's not enough. Some people, they need 3 or even 4 liters of water in their day in order to make sure that stool is soft enough that it can really move effectively through the digestive tract. So again, just a little recap for you, my top 5 reasons that people experience acne. Number 1 is hormone imbalance. Number 2 is that they have high stress levels. Number 3 is they have a sluggish liver. And number 4 is they have a food intolerance. And my last but not least, number 5 is that they're experiencing constipation. So if any of these things are something that might be triggering a reason for you as to why you are experiencing acne, please feel free to book an appointment with me. You can either call our office or send us an email or go to our website and you can book an appointment with me. I'd be happy to see you and happy to work through any of these concerns with you. As always, thanks so much for watching, everybody, and I hope you have a really great week.